Kwe, Tanse, Unusakut, good morning, Watkwanuiradu, bonjour. I'm speaking to you today from the traditional territory of the Algonquin people. The healthcare system failed Joyce Etchequan. It's failed Indigenous peoples. It is a failure of all levels of government. The event we all saw reinforced the distrust in a system that can only succeed through trust. Whether it's a COVID-19 testing or the seasonal flu vaccine or eventually a COVID vaccine, that trust is essential. We must earn it and we must maintain it. Tomorrow, Carolyn Bennett and I, along with other ministers, will meet with Indigenous representatives and health professionals, representatives of Canadian health associations and representatives from provinces and territories to start the work to eliminate the systemic racism experienced by First Nations, Inuit, and Métis in Canada's healthcare system. This meeting will focus on the experiences of Indigenous peoples with systemic racism in federal, provincial, and territorial health systems. It's an urgent call for action where those present will be tasked to reflect upon the information shared, as well as the well-documented existing body of work on systemic racism in the healthcare system to inform concrete measures that we can all take so that Indigenous peoples can access the best care, first-class care, the same the rest of us enjoy. This is not a new concern, but it is an urgent one. It would be naive and betray a fundamental misunderstanding of the grave problem posed by racism and systemic racism to think that this will be solved or that we will all have answers by Friday afternoon, or that this can all be addressed by firing a couple people. Denying this problem will not make it go away. Racism kills, and systemic racism kills systematically. The federal government does not unilaterally have all the levers to address these issues and implement the changes needed. The federal government does have a legal obligation towards First Nations on reserve and Inuit in funding. And what we know is that when Indigenous peoples have control and care over their health care, the results are better, and this is proven. Le système de santé a laissé tomber et abandonné Joyce Etchequan. Ce système a laissé tomber et abandonné les peuples autochtones. C'est un échec de la part de tous les niveaux de gouvernement. Les événements dont nous avons été témoins ne font qu'accroître la méfiance envers un système qui ne peut remplir sa mission qu'avec la confiance de chacun d'entre nous. Que ce soit pour les tests contre la COVID ou les vaccins pour la grippe saisonnière ou éventuellement un vaccin contre la COVID, cette confiance est essentielle. Nous devons la mériter et nous devons la maintenir. Demain, Carolyn Bennett et moi, ainsi que plusieurs autres de mes collègues, allons rencontrer des représentants autochtones, des professionnels de la santé, des représentants d'associations canadiennes du domaine de la santé, ainsi que les provinces et territoires dans le but de débuter le travail nécessaire afin d'éliminer le racisme systémique présent dans le système de santé canadien et vécu par les Premières Nations, les Inuits et les Métis. Ce n'est pas un nouveau problème, mais il en est un urgent. Non seulement serait-il naïf de croire que le problème du racisme et du racisme systémique peut se régler en une seule rencontre, ce serait une profonde incompréhension du réel problème que représente le racisme systémique dans notre société. Le racisme tue et le racisme systémique tue systématiquement. Le gouvernement fédéral ne peut unilatéralement adopter et mettre en œuvre les changements nécessaires pour répondre à ces problèmes. Ce que nous pouvons et nous avons le devoir de faire, c'est d'exercer notre devoir moral, de condamner le racisme sous toutes ses formes et de rassembler tous les acteurs qui, ensemble, peuvent faire une différence. Suite à la rencontre de demain, nous pourrons partager plus d'informations sur la façon dont nous irons de l'avant pour regagner la confiance des peuples autochtones. Now I'll turn to the health crisis that's been putting Indigenous lives and all Canadians' lives at risk for the past 7 months. In recent days and weeks, we've seen an alarming rise in the number of new and active COVID-19 cases across the country. That includes Indigenous communities such as York Landing First Nation and Little Grand Rapids First Nation, where we are seeing outbreaks. Last weekend, Indigenous Services Canada deployed medical health structures to assist communities with their ability to respond to these outbreaks. 2 relief shelters have now been deployed and installed within Little Grand Rapids First Nation. And Indigenous Services Canada is working closely with Chief and Council of Little Grand Rapids First Nation, the First Nations Response and Pandemic Coordination Team, the Southeast Resource Development Council, and the Canadian Red Cross to coordinate resources in response to the community's priorities. We remain in constant communication with community leadership and stand ready to provide additional support as needed. I'd also note that we've seen an alarming spread in Saskatchewan due to a gathering at the Prince Albert Full Gospel Outreach Centre, and we continue to monitor that situation closely. En date du 14 octobre, nous savons qu'il y a 206 cas actifs de COVID-19 dans les communautés des Premières Nations vivant dans les réserves, pour un total de 906 cas confirmés. 684 personnes sont rétablies et on recense 13 décès. Au Nunavik, au Québec, on dénombre un total de 28 cas positifs confirmés chez les Inuits. Tous se sont rétablis sauf 5. Ces chiffres sont troublants. Nous voyons déjà les conséquences de la résurgence de la pandémie, mais nous restons déterminés. Nous sommes prêts à prendre les mesures nécessaires face à la COVID-19 et notre priorité demeure la santé et la sécurité des peuples autochtones. Alors que la pandémie évolue, nous continuons d'assurer un accès durable à des services de bien-être et de santé mentale pour appuyer les communautés autochtones, entre autres avec la ligne d'écoute d'espoir pour le mieux-être. Ce numéro est le 1-855-242-3310. The number for the Hope for Wellness hotline for people in distress is 1-855-242-3310. Nous continuons de travailler en partenariat avec les organisations et les communautés autochtones pour appuyer l'adaptation et la prestation de services du bien-être mental dirigés par les Autochtones, et nous continuerons de le faire tout au long de la pandémie et bien au-delà. Je tiens d'ailleurs à souligner le travail remarquable qui a permis aux communautés autochtones de contrôler l'impact de la COVID particulièrement bien au cours de la première vague. Et je suis convaincu qu'un tel travail et le leadership autochtone fera encore une fois la différence alors que nous entrons dans une nouvelle vague alarmante de la COVID-19. Je rappelle à tous que pour rester en sécurité, il faut suivre les conseils des experts en santé publique et continuer de suivre les mesures nécessaires pour aplatir la courbe. Avoid large gatherings, stay home, practice physical distancing, wash your hands frequently with soap and water or hand sanitizer. I cannot end this conference, however, without addressing the incidents in southwestern Nova Scotia and what amounts to an assault on the Mi'kmaq people. These unacceptable acts of violence, including the assault of Chief Sack, threats and intimidation, some racist in nature, cannot and will not fetter the right of the Mi'kmaq people to pursue a moderate livelihood as affirmed close to 25 years ago in the Marshall decision. This is a right that has existed since 1760. To perfect that right, space needs to be afforded to Indigenous leaders to continue discussions with the Department of Fisheries and Oceans and Minister Jordan. And they are not easy discussions, but they must be had and they must be respected. To do so, clearly, our police forces must foremost maintain the peace. Miigwech, Nakumik, Marsicho. Thank you. Merci à tous. I omitted to mention that I'm here today with Chief Medical Officer Tom Wong, who is prepared to answer questions as well, more of a technical medical nature if need be. Thanks. Adrienne? Non, Tom va répondre aux questions seulement.
Nous allons maintenant répondre aux questions des journalistes, une question et une question de suivi. We'll now take questions from journalists, one question, one follow-up. Nous commencerons par 3 questions du téléphone. We'll start with 3 questions from the phone. Operator, over to you.
Thank you. The first question is from Émilie Bergeron from Agence QNI. La première question est de Émilie Bergeron de l'Agence QNI. Please go ahead. À vous la parole.
Oui, bonjour, M. Miller. J'aimerais avoir un peu plus de détails sur la rencontre d'urgence de demain. Quels représentants des Premières Nations peut-vous nous donner une idée lesquels ont accepté, ont confirmé qu'ils prendraient part à la réunion?
Merci, Émilie. D'abord, la rétroaction a été incroyable. On a à date à peu près, ça frise les 200 personnes qui ont confirmé leur présence. Évidemment, c'est une présence qui, étant donné les mesures hygiéniques en place, doit se faire virtuellement. Mais nous avons 200 personnes de confirmées. Oui, nous avons invité le leadership autochtone, évidemment des organisations nationales, mais aussi les chefs, le chef de Manoine, le chef régional, Justin Picard. J'ai toute une liste. Ils ont hâte d'être là, d'écouter. Évidemment, la place n'est pas forcément aux politiciens pour faire des discours. Évidemment, je vais tenir le mien s'il y a lieu au strict minimum, mais vraiment d'écouter ceux qui vivent l'expérience, les professionnels de la santé. Alors, c'est une rencontre qui est vraiment axée d'abord et avant tout à cette réalité qui est vécue dans le domaine de la santé d'une façon quotidienne par les gens qui exercent leur profession. Alors, oui, il y aura de l'espace pour les gens de s'exprimer, pour les politiciens de s'exprimer, surtout de réfléchir sur des témoignages qui auront lieu en avant-matinée. Mais ce n'est pas, oui, c'est une rencontre qui est en soi de nature politique, mais vraiment axée sur les expériences des personnes qui vivent ça de façon quotidienne, évidemment informées par tous les rapports qui sont écrits depuis belle lurette. Yeah, so, hi, Mike. The question was about the Indigenous leadership that it accepted, particularly from Quebec, and we have a number of, the acceptance rate for this has been, I think the latest check as of 10 o'clock was about 200 people had accepted to be part of this. This is a meeting that, yes, involves the participation of provincial and territorial representatives and leadership, but also Indigenous leadership. I would hasten to say that this is not a meeting that is creating a space for politicians that already have that public platform. Obviously, there will be an occasion to speak, but it is focused foremost on the lived experiences of professionals in the healthcare system, mostly Indigenous, that will be speaking about their experience informed by the body of work that is existed and is written down on the reports, the various reports that have been issued over the last decades. There will be a space for politicians to say a little bit at the end, reflecting on what has been said, and then moving towards a longer, medium to longer term plan to reconvene and to have concrete actions to propose and put forward. As I mentioned in my speech, the levers of the federal government in matters of health, the jurisdiction that's jealously guarded by provinces, and is something that is limited, and we can't help but acknowledge that we must. But we do have the moral authority, legal authority, particularly in our powers to spend, which is entirely jurisdictionally and constitutionally legitimate, and also to convene, call out racism, and to coordinate and to create expectations within a system that has failed Indigenous people.
Emily, est-ce que vous avez une question de suivi?
Oui, merci. Je voulais savoir, vous avez mentionné la participation de représentants des provinces. Du côté du Québec, quels représentants vous ont confirmé leur présence? Et je sais que vous venez de dire que les politiciens vont avoir une intervention limitée, mais pensez-vous que ça pourrait être une occasion, de votre point de vue, pour le gouvernement Legault de reconnaître l'existence du racisme systémique?
J'ai, pour l'instant, Émilie, j'ai la présence, à moins de faire une erreur de la ministre Blais et du ministre Lafrenière et d'autres fonctionnaires. Je ne veux pas m'avancer avant de reconfirmer. Évidemment, ils ont toute l'occasion de s'exprimer sur toutes les tribunes en ce qui a trait à leur point de vue, que je respecte profondément, évidemment. Et donc, oui, je l'ai peut-être dit en anglais plutôt qu'en français, mais c'est l'occasion, ce n'est pas l'occasion nécessairement de faire des énoncés politiques, mais d'écouter, de réfléchir sur ce qui existe, ce qui est un constat quotidien de gens qui vivent et qui exercent leur profession dans le système de santé, surtout autochtone, d'adresser ce qu'ils auront à dire en réfléchissant à ce qui est déjà ce qui a déjà été est très bien connu et je vous dirais très accepté dans les commissions qui ont été que nous connaissons tous, dont le rapport vient.
Merci. Prochaine question.
The next question is from Kirsty Kirkup from the Globe and Bell. La prochaine question est de Kirsty Kirkup de Globe and Bell. Please go ahead. La parole est à vous.
Hi, good afternoon, Minister. I wanted to ask you, I know I asked you recently about the federal health transfer and how that actually could be a lever used by the federal government to stipulate some standards around care and the need to address systemic racism in health. To what extent at this point has that been explored? Because I appreciate your point around, the need to have a discussion about this issue, but there is a lever that could be used, at least according to some policy experts, and I'm wondering if there's any consideration around that, given there is a discussion happening today between the Prime Minister and the Premiers.
Well, I believe, you were quoting Senator Sinclair and many others who have suggested this. It is the federal power to spend with conditions is clear. It is a constitutional right. It exists within health. The question then is how best to do it. I don't think withholding funds, particularly during a pandemic, is the right way forward. People's lives are at risk. This isn't a game. And what we really need in terms of jurisdictions are for governments to exercise their jurisdictions properly, particularly when it comes to serving Indigenous peoples to the best of their abilities. And that includes within the healthcare system. The power to spend and associate conditions to it is well documented. What we're talking about here is walking into an inherently conflictual situation and punishing people, which is certainly I wouldn't recommend during a pandemic, and I wouldn't recommend when we're trying to tackle something that falls within the jurisdictions of provinces, which is to tackle racism. Putting more money into a system which is beset by systemic issues with respect to systemic racism it can't be the only solution nor the only reply. This is about standards. It's about moral authority. It's about guidance. It's about holding professional organizations to account. And yes, sure, it's about firing people when they commit egregious acts. But it's also about learning cultural sensitivity and cultural frameworks, all paths of solutions that have been advanced so far by policy experts. But we also need to hear more and see how we can best help and foster and support those at the federal level.
Christy, do you have a follow-up?
Yeah, just as a follow-up, I'm wondering about, you specifically talked about the situation in Nova Scotia. I'm wondering, do you have any thoughts on how the RCMP handled that situation? There's been quite a strong critique by a number of individuals about the response by the RCMP. This is a big conversation right now about systemic racism in policing as well. Do you have any thoughts on that?
I do. The first job of the police is to serve, protect, and to preserve the peace. What I saw on video is probably a limited snapshot of what went on, but it was obviously alarming. People need to be protected, and space needs to be given for negotiations to be had under very difficult circumstances with Chief Sack and his people. This is the duty of the police. Again, I hesitate to speak more about it because preserving the peace is not a finality in and of itself. It is a process that needs to be maintained, and it includes more than these acute events. That may sound a little philosophical to you, but I think it's an important takeaway from what we've seen earlier on in the year with respect to the Wet'suwet'en and solidarity movements and rail blockades. Police are an integral part of that, and their engagement with the population has been at issue in the last, over the course of this year. There's some exceptional people within the police force, and there are also some systems that are beset by systemic racism that need to be addressed. Hard to hard to import all those thoughts into a particular video clip. But I was as alarmed as anyone that saw the videos over social media over the last few days.
Prochaine question. Next question from the phone.
The next question is from Anne-Marie Hyven from Radio-Canada Espace. La prochaine question est de Anne-Marie Yvon de Radio-Canada Espace. Please go ahead. À vous la parole.
Oui, bonjour, merci. En fait, la question est toujours un peu la même que tout le monde. J'ai envie de parler de racisme systémique. Vous avez dit, M. Miller, que le racisme systémique tue systématiquement. Mais si le gouvernement du Québec et le nouveau ministre des Affaires autochtones n'acceptent pas de dire qu'il est question de racisme systémique, comment est-ce que vous allez pouvoir discuter avec lui? D'après ce que j'ai compris, il sera présent demain à la rencontre, mais comment une discussion peut avoir lieu? Comment on peut s'écouter les uns les autres si on ne parle pas de la même chose?
Merci Anne-Marie. D'abord, 2 éléments de réponse. Le fait de ne pas reconnaître le racisme systémique continue de blesser le peuple atikamekw qui le vit à chaque jour et qui l'a vécu de façon aiguë en voyant la mort de Joyce Echaquan. Ne pas reconnaître l'existence du racisme systémique empêche l'habilité d'avoir des politiques qui sont appropriées pour enrayer le racisme systémique. Ça devient donc une politique à l'emporte-pièce. On ne peut pas régler ce problème en congédiant deux, trois personnes, ni peut-on s'attaquer aux bases puis aux fondements qui sous-tendent l'existence du racisme systémique à l'intérieur de notre système de santé. Donc, ça empêche les résultats et le nier ne fera pas en sorte qu'elle disparaisse du jour au lendemain. Alors, mes interactions avec le gouvernement du Québec, en tant qu'adulte, je peux avoir des points de vue qui ne sont pas les leurs. C'est quelque chose, j'ai besoin de leur complicité pour enrayer le racisme qui existe dans le système de santé. C'est eux qui ont beaucoup de leviers et je suis content de savoir qu'ils vont s'attaquer aux problèmes. J'ai pu parler en fin de semaine avec le nouveau ministre de Lafrenière puis on a eu une belle conversation. Si je suis en désaccord avec lui, je vais le dire, puis s'il est en désaccord avec moi, il va le dire très clairement, je le présume. On a toujours cette fâcheuse manie d'approcher ou de typifier nos relations avec les provinces comme étant un peu comme la lutte professionnelle, en s'interpellant constamment, mais ce n'est pas une façon mature de procéder. J'ai besoin de leur complicité. C'est pas en dénonçant des propos sur toutes les tribunes que je vais pouvoir avancer dans mon devoir en tant que ministre d'enrayer ce fléau qu'est le racisme systémique. Alors, nous continuerons nos conversations. On regardera les points de convergence. On verra où on pourra remédier à ce qui s'attaque aux soins de santé qu'ont droit les peuples autochtones, et c'est-à-dire des soins de santé de première classe dont nous jouissons tous en tant que non-autochtones à tous les jours.
Marie-Yvonne, est-ce que vous avez une question de suivi?
En fait, oui, une question toute simple. À quelle heure a lieu la réunion demain?
Et je pense que ça commence c'est une réunion qui est de plusieurs heures, 3 heures, à 11 heures, si je ne m'abuse, peut-être à 10 heures, je ne suis pas certain.
C'est à 11 heures, oui.
C'est à 11 heures, non.
D'accord, merci.
OK, on va maintenant prendre des questions de la salle. We'll take questions from the room now. Would you like to go ahead?
Minister Miller, this is for you and the doctor. I just want to talk about the number of active cases that we have in Indigenous communities. Last week, and correct me if I'm wrong, it seemed like there was 118 active cases. It seems that this week we're reporting 209 active cases. You warned last week that this second wave could be worse for Indigenous communities. How worried are you now with the numbers and the direction they're going in, that this will actually be devastating for Indigenous communities?
Well, look, Mike, I don't think any of us were as prepared as we could have been for the first wave, and certainly given the historical inequities that are well documented and the socioeconomic health gaps that exist, certainly in Indigenous communities were a step behind, and so it was of immense concern to the entire department at the very beginning, particularly as information was partial as to how COVID behaved and acted and how it would hit. So the key part at the very beginning, and I've mentioned trust, was getting information out into communities, giving the control and care of resources, particularly financial resources, but also nursing resources, PPE, all these issues that we've talked about generally in the media, to helping people stay safe. So we learned as we went, and Indigenous leadership took a number of measures that they shouldn't have had to, given the circumstances and the cards that they were dealt with at the outset, being less equipped than non-Indigenous communities to deal with this pandemic. If Montreal can get overwhelmed, the healthcare system in Montreal can get overwhelmed. Certainly a small remote community, fly-in access, can easily get overwhelmed as well, and particularly with high incidences and comorbidities that exist associated to COVID. We had a bit of luck and we worked hard, but the numbers were good. And the easy comparable, and the information is impartial, are our neighbors to the south. And if you look at Indigenous communities in the U.S., the numbers that we look at from an epidemiological perspective point to Indigenous communities hit 3.5 times harder than non-Indigenous communities in the U.S. The rate at the first wave in Canada is a third of that of non-Indigenous communities. So Indigenous communities have fared better. They're now more properly equipped, but that vulnerability still exists. And you see it with the drop in vigilance and more community movement in and out, despite some of the resources that we've deployed, dedicated charter services for nurses, learning from H1N1 and making sure people are prepared, that health practitioners aren't they themselves vectors of transmission. And where COVID has popped up, communities have done exceedingly well at stamping it out. Now, you mentioned the rate of, I have 206 as a number, but it could be 209. That is, I think, the highest that we've seen it to date at any date. And so it's very alarming. The nature of the transmission, community gatherings, weddings, funerals, gatherings of a religious nature, people having parties, things we all do, is something that is very scary. And so we're continuing our work and refining our communications message and our discussions with leadership to make sure that they are prepared and that we stand prepared to provide surge capacity in communities. And we are doing things that we don't ask non-Indigenous communities to do. Isolate while it is very sophisticated medical tents, they're the result of overcrowding that can't be, if you have a community where you have several generations in one household, there are people in that household that will not only spread COVID more, but particularly the elderly person. We did have a bit of luck with elderly homes insofar as they hit harder in urban centers than they did in Indigenous communities, but we had a head start. So we warned them and we got the message out that if you need anything, we'll help you protect your elderly homes, where we have seen the largest rate of morbidity. But it's something that's we constantly assess and reassess, and every morning we wake up and get briefings about what's going on, and we continue to try and get ahead of things. But I would say that, yes, the absolute active case rate, even though 206 may seem small, every mobilization or every active case that sort of starts spreading in a community requires a huge mobilization that it wouldn't necessarily in an urban center. So there is a very real and present logistical challenge. Right now, it's something that we have a good grasp of. But as you see the numbers climbing and you look at the epigraphic, it's very alarming. Tom, please, if you could add.
Absolutely. Regarding this virus and what we're seeing in First Nations communities, as well as across Canada in non-Indigenous communities, we see rapid rise over the past month. This is very concerning. However, there are so many things that we have been supporting the community, and Dr. Tam has been supporting all the provinces and territories to do. We need to renew our efforts to limit non-essential travel in and out of communities, keep physical distancing, avoid crowds, avoid large gatherings, wear non-medical masks when distancing is not possible, adhere to hand and respiratory hygiene, stay home when sick, unless for medical appointments, protect the elders. And that's one of the things that First Nations on reserve have been showing the world, that during the first wave, they have been able to protect the elders with no outbreaks, such as in the south. In the north, there's no outbreaks, in nursing homes, in elder lodges, and long-term care facilities. And we need to learn, from the communities. We need to support the communities. Flu season is here. We need to actually promote, the uptake of a flu vaccine, as well as a pneumococcal vaccine. And when the COVID vaccine comes, that's another public health tool to help support and protect the community. We have to have better control, support the communities for diabetes, for cardiac diseases, for lung diseases, for high blood pressure, for overweight, and address vitamin D deficiencies. Also, avoid tobacco and avoid vaping. All of those things are very important. And last but not least, importance of supporting communities in fighting the mental wellness and promote mental wellness. It is so important because it is very hard in the north to be in isolation, and yet we need to support the community and individuals and the elders and the young people so that we could promote mental wellness, both by promoting on-the-land activities. If there's no complete shutdown of the communities, if there's physical distancing, there, and avoiding crowds and wearing masks, all of those can be done because the land and the culture, is part of healing. Thank you.
Just as a follow-up to both of you, maybe, you both sort of touched on it a little bit, especially in the north with the winter coming, and in multi-generational homes with the numbers going up. At what point and what is the plan to try and figure out? Because in some homes you can't self-isolate. There are too many people in the home. So what can the federal government do to give reassurances to these communities that there will be that support, but what are you telling these communities that they need to do as we are seeing the numbers tick up?
Look, luckily in the far north, we've largely avoided this problem. It is clearly a challenge that we need to face. So the medical structures, the movable medical structures, have inserts that can go down to -40. It's not obviously ideal. It's not even ideal during the summer, but we are moving to ensure that we do have the capacity to deal with those acute situations. Fixing overcrowding through new house builds is extremely challenging, not only during outside the build season, which is exceedingly short in the north, but also during COVID. This is one of the reflections that we've made clear to ourselves as colleagues in cabinet and reiterated in the throne speech, that we need to move a little more aggressively on closing that infrastructure gap, because we know that should we go into another epidemic, we can't go into the epidemic with that level of overcrowding and predispositions, particularly when it comes to respiratory diseases that Indigenous people face and continue to face versus vis-a-vis the second wave. And we will continue to appropriate and to adapt our surge capacity to reflect the reality of the north and the need to move quickly. It is in part why the second round of Indigenous funding had a direct distribution of capital into the communities, but also appropriation of funds to deal with increased surge capacity, to deal with specific targeted responses in communities where you see spread, as opposed to doing it in a little more even fashion, but not reflective of a spread of a pandemic from the first wave vis-a-vis the second wave. So we've taken those financial measures to appropriate those funds, but it's a constant ongoing evaluation and fail testing as we see the second wave hit. The importance we don't want to make mistakes, but the importance is to make them now before the winter hits so that we can learn from them. Tom?
Yeah, the department has procured and acquired 144 such mobile structures, to accommodate, all kinds of needs, including the needs for isolation, for temporary accommodation, as well as provision of services. And one of the things that, just an example, recently, in Little Grand Rapids, when there's the outbreak, the community asked for, structures to be actually brought in, and the department had mobilized 2 such structures into the community for that purpose. Thanks.
Mackenzie, would you like to go ahead?
Hi, Mr. Miller. Mackenzie Gray with CTV News. On the Nova Scotia fishery dispute, the RCMP seemed to stand by when there was cars that were burnt, there was looting, there was people peeing on vans, a whole variety of things that an angry mob of fishermen did. Why did the RCMP not step in? Can the RCMP actually defend the rights of the Indigenous people in that community? And if you think they can, why should they trust and believe that they will actually be able to do that if this issue happens again?
Well, Mackenzie, I think that's a next question. You need to ask of the RCMP, and I'm wondering myself. Again, it's a video, and it's alarming to see it. I don't have the full picture of what exactly went on. Our emergency teams in government are assessing and continue to reassess what exactly went on. It's clear that there is distrust from Indigenous peoples with respect to the RCMP that predates this incident. This is perhaps more evidence to them that is the case. Foremost, the RCMP has to preserve the peace, and we expect, as a government, even though it is a delegated entity to the province of Nova Scotia, that they foremost keep the peace, and that is their job, and all Canadians expect them to do it.
I will say for the record, we've asked the RCMP and they haven't got back to us, but on a separate issue, federal government, one thing that you're able to do is convene a meeting with both the Indigenous fishermen, the commercial fishermen. This is something that the Premier of Nova Scotia has asked for and both sides of the dispute has asked for. This is not a new dispute. Why has this not happened yet? And is there a meeting that is in the works?
First, we're talking about a fundamental right to earn a moderate livelihood that is a right that the Mi'kmaq are entitled to exercise. The Marshall decision clearly said that in elaborating what that right was based on the treaty in 1760, was that it was in follow-up commentary subject to regulation. And so that's really what we're talking about. There's concerns here obviously over the state of the fishery industry, illegal fishing, which is not Indigenous. It's well documented that that is occurring. So there are elements to be discussed with the commercial fishermen over a number of issues. Whether that occurs within the season or outside it is another set of considerations. It's very hard to prejudge a negotiation from my perspective. It is very important to have that and to ensure that we can get to a definition of a moderate livelihood that reflects the Mi'kmaq right that has never been defined in a way that that has been accepted by all, and that's wrong. So I've tremendous confidence in Minister Jordan in how she is negotiating with the Mi'kmaq, but there is also a discussion to be had with the commercial fishermen to educate on one hand, to sensitize, but also to ensure that ultimately they are part of the process. It's very dangerous to be on the waters without a conflictual situation. It's deadly when there is one. And so that is the risk. The risk, if we don't get this right, is that people will die. And I think everyone should be clear about what that means, because violence begets violence. It's unacceptable, and that space needs to be created for those discussions and that place to be had to perfect a right that has existed since 1760.
Would you like to go ahead?
Thank you. Hello, Mr. Miller. My name is Marc. I'm with the Canadian Press. I want to ask you about the agenda of tomorrow's meeting. Now, you said there are going to be almost 200 of Indigenous leaders. They're going to be able to share their stories and their perspective on systemic racism in the health sector. But what are the specific measures that will be discussed tomorrow to address the issue or to put in place a plan to stop systemic racism in the public health sector?
These are questions all Canadians want to know. I would hasten to say that it's not up to me to dictate what that is. There's a well-informed body of work out there that exists already. So you might ask me, what's the purpose of this meeting? And the purpose of this meeting is for now over 200 people, including some of Canada's top leadership, Canada's top Indigenous leadership, to listen to those that have experienced it on a daily basis. The task then will be to sketch out and to, based on that testimonial, based on those views, based on professionals that are highly educated Indigenous professionals that are living racism every day, to see how we can all work together. This isn't a conflictual situation. This is an opportunity for people to share their experiences, their paths forward for leadership after that, in a limited fashion, to reflect on what was said so that we can have a clear pathway, for example, in January, to come back to the table with goals, pathways to ensure that professional organizations are doing their job, that there is a cultural sensitivity screening and education at all levels, that there is more Indigenous recruitment within the medical profession, that there is more education, there is accountability. These are all things that you can imagine are things that people have been asking for some time, and the breakdown of which should never have occurred. But again, it's naive to think that all the solutions will come out after one high-level meeting with a limited amount of time. But also, it just would betray how serious this is in our society in situations where people are at their most vulnerable and are at the risk of dying, and racism does kill. We have to acknowledge that. There are a variety of levels where we will need our provincial and territorial counterparts to work with us and within their jurisdictions and us within ours, and then working together in some common areas that touch and concern Indigenous peoples. But I'm not going to presuppose the conclusion of a meeting that is yet to occur. Thanks.
I have a follow-up, actually, a bit related to the question. The Canadian Institute for Health Information has been working on a plan or approach to include race-based data in healthcare. And also, yes, maybe you have heard of this before, but the the Canadian Public Health Association also is calling on all social and health services to include demographic data in their work to understand what's going on in their services, including healthcare. So, do you support this? What are your thoughts on this?
Well, I think if there's anything to learn from what we have seen during the COVID pandemic, is that if we can't do good policy if we don't have good data. Tom has been at the forefront of pushing for distinctions-based data gathering really at the front line, at the point of testing, and then following up, because that epidemiological data is key in targeting answers, actually in short-term solutions and deploying where people are more vulnerable. We've seen the data that I quoted to Mike earlier about Indigenous populations in the U.S. comes from 23 states that do, in fact, gather it. But it doesn't happen in all states, and it certainly doesn't happen in the best fashion in Canada. We have Dr. Janet Smiley from the University of Toronto that is working on sort of disaggregating that data and getting us a better understanding of how the Indigenous population, for example, has been hit. So I absolutely support the principles. I haven't read it, but I do support the principle because we live it, and we live the imperfection of data on a daily basis and our ability to act. The 906 cases that of COVID that have hit Indigenous communities on reserve is a snapshot of the Indigenous population. It far understates how many Indigenous people, for example, those that live in urban settings, those that don't self-identify, and in some cases you have a dozen jurisdictions with different boxes to tick as you get tested. So putting that all together in real time, teasing out information and being able to deploy solutions and then good public policy is certainly a challenge. And if we can head that off, I think it's something that Minister Chagger's been pushing hard at, and the various ministers in government have been pushing hard to obtain, and when we continue to do so. And I think Tom can speak more at length on that.
Thank you so much, Minister. we are working with First Nations Information Governance Center. We are working with ITK and MNC, the leaders in First Nation, Métis, and Inuit, in order to facilitate discussion with provinces and territories, about the collection of First Nation, Métis, and Inuit data, and to facilitate the sharing of data with First Nation, Métis, and Inuit, so that they can have the ability to analyze the data and to use the data. So this is a very important, step. And so the, what you mentioned about the Kai-Hai report and the initiative, we welcome, such initiative, when, the involvement and the partnership involves First Nations, Métis, and Inuit. And for this work, we work with multiple departments, including Public Health Agency of Canada, Health Canada, Statistics Canada, Kai-Hai, etc. I think that Canada really needs to actually look at ethnocultural based data in order to look at the gaps. And Canada cannot do it alone. Canada needs to be doing this in partnership with the affected communities, whether it's First Nation, Métis, Inuit, or other ethnocultural groups.
We'll prendre une autre question par téléphone. We'll take another question from the phone. Operator?
Thank you. The next question is from Christian Noël from Radio-Canada. La prochaine question est de Christian Noël de Radio-Canada. Please go ahead. À vous la parole.
Bonjour, M. Miller. J'aimerais revenir en français sur ce qui se passe dans l'Est avec la pêche au bar et le Mac. Dans votre déclaration tout à l'heure, vous avez dit que les policiers doivent maintenir l'ordre. Avez-vous l'impression que ça n'a pas été fait dans les événements récents? Quel risque est-ce que ça crée? Est-ce qu'il faut intervenir? Qu'est-ce que le gouvernement fédéral attend pour intervenir?
Merci, Christian. Je ne sais pas si je vous ai bien entendu sur la ligne, mais j'ai vu ce que vous avez vu sur les médias sociaux. Je n'ai pas tout le portrait de ce qui s'est passé, mais évidemment, ça me dérange de voir la violence gratuite, inacceptable, ou ton raciste envers, d'abord, violence envers le chef SAC, destruction d'une voiture, des actes d'apparence criminelle. Et le devoir numéro 1 de la police, c'est de servir et de garder la paix. Alors, difficile de m'avancer davantage, mis à part ce qui saute aux yeux. En ce qui a trait à l'implication du gouvernement fédéral, nous sommes impliqués en négociation avec, d'abord avec le chef SAC et son peuple et le peuple Mi'kmaq quant à leurs droits de traité qui existe depuis 1760 et affirmé dans l'arrêt Marshall. Alors, c'est clair que la violence ne peut arrêter l'exercice, l'affirmation de ce droit. Et ce que nous demandons, exigeons, c'est que la police garde la paix.
Est-ce que vous avez une question de suivi?
Oui, merci. Je comprends ce que vous dites, mais en même temps, vu de là-bas, les citoyens ont l'impression que le gouvernement fédéral se croise les bras et attend que l'irréparable se produise avant d'intervenir. On a vu des choses qui sont produites. Justement, vous parliez de Burnt Church. Est-ce que vous attendez que quelque chose d'irréparable se produise avant de mettre votre pied à terre?
Non.
Vous attendez quoi?
On n'attend pas.
On va prendre une dernière question par téléphone. We'll take one last phone question.
The next question is from Jamie Pachagomskom from APTN. La prochaine question est de Jamie Pachagomskom de APTN. Please go ahead. À vous la parole.
Hi, thank you. You mentioned an outbreak in Saskatchewan at a gathering at a full gospel center, I believe you said. Could you give some more details on how that happened with their gathering?
Thanks for the question, Jamie. It appears to be a meeting at the Gospel Center in Prince Albert. I think there's still some active tracking going on. People then dispersed and went back into their communities, so it has caused what appears to be initial outbreaks in those communities. We should have more, we're obviously tracking it quite intensely and should have more details to follow. Part of this, and it's important in all these situations, not to judge. I think when you do, it prevents people from disclosing information that is so critical in stamping out COVID, tracking and tracing and full disclosure of information. So I'm hesitant to discuss too much information publicly. But Tom, I think if you have any more additional information you can share, I'd encourage you to do so.
This really highlights the importance of many of the service organizations and institutions, facilities, really doing great work across Canada to support underprivileged and providing spiritual support. However, one of the things that's so important is the avoiding big crowds, maintaining physical distancing 2 meters apart, and wearing non-medical masks when it's not possible to do so, and hand hygienes and all of the public health measures that we talked about. Sometimes people may forget, and so we see in situations like that in a small indoor environment, where they're gathering a large number of people without physical distancing, unlike in this room, where we see, the physical distancing and the wearing of masks when that's not possible. So I think that this is a wake-up call, very important to remind ourselves and support each other in order to do better tomorrow. Thanks.
Jamie, do you have a follow-up?
Yes. Concerning the relief, you said you have 144 and you've deployed 2 so far. When you deploy these shelters, are you also sending like nursing resources along with it, or is it just the shelter?
Yeah, it's not. We've deployed a number of them in a number of communities, Jamie, that in fact that you've personally have covered. So that number is far greater. We could get you a detailed count of how many we have. Tom was referring to the resources that we have available to deploy in general, and prepared to do so on an expedited basis. They are used for quarantining and for testing and for isolation. They aren't intended to be permanent in nature. They're intended to be able to respond to spreads as and when they occur for specific medical purposes, being negative pressure structures that are intended for medical use but can be expanded, obviously, and adapted for the extreme cold. And it's something we're moving for the winter. But I think Tom can talk a bit more about the numbers, and if not, we can get you those information. But obviously, the 2 that we mentioned are in Little Grand Rapids, and should they need more, we're in constant communication, and I was over the weekend with the emergency team to ensure that they were being deployed. But should they need more, there will be more to be deployed.
In addition to the 2 medical structures requested by the community of Little Grand Rapids, there's a mobilization of a rapid response team together with, in collaboration with the province and Red Cross. And in total, over 20 people were invited on the ground to support communities in a situation like that at Little Grand Rapids. As the minister just said, that type of rapid assistance is happening across the country in different communities when there is a need to do so. And we are on standby when the community needs more additional facilities, these mobile facilities, or need nurses, paramedics, physicians, etc.
Thank you. This concludes today's press conference. Ceci met fin à la conférence de presse. Merci.